Welcome to Making Capitalism Sustainable on True Chat. Reasoned solutions to economic and educational issues facing the nation. From the CED studios in Washington, D.C., here's your host.
Thank you for tuning in. I'm Caroline Ferguson, researcher at the Committee for Economic Development, or CED. Today, I'm here with Joe Minerick, Senior Vice President and Director of Research at CED, to talk about healthcare as part 3 of our Debt 101 series. In parts 1 and 2 of this series, which you can find on our website at www.ced.org, we discussed what the U.S. national debt is and why it matters, and how we might possibly lower it. As you now know, the U.S. has a debt problem, unlike any it's encountered before. Hi, Joe. Thanks for joining us today.
I'm happy to be here.
So one of the largest contributors to our debt problem from the cost side is the cost of healthcare. In fact, healthcare is the single greatest cost to the American government, even larger than defense, and it's only going to get more expensive with time. So where does healthcare fall exactly percentage-wise in terms of government expenses?
Well, interestingly enough, if you take Medicare and Medicaid, the two main federal healthcare programs, Medicare is the healthcare program for the elderly and for the disabled. Medicaid is the healthcare program for the low-income population, including the indigent elderly. You add them together and you get almost a quarter of the federal government spending. Social Security is another quarter. Defense is 17%. And then you're going down in size from there. So healthcare is the biggest part of the federal budget. And as you noted a moment ago, it is growing a lot faster than other parts of the budget. And that is an ominous reality.
Interesting. So then in terms of actual dollars, how much would that be in 2017 or 2018, if you have that information?
Well, we're looking probably at about $1 trillion. $1 trillion, if it showed up in your checking account, you'd notice it's a big number. And it is definitely one of the things that causes us headaches when we try to think about where the budget is going.
So then where do Americans get their health insurance? So I know that there's employment-based coverage, and that accounts for a lot. Does that affect the national debt? If not, what does?
We have about 2/3 of the working age population and their dependents covered by employer-based insurance. So if you look at everybody, including the elderly, that's in round numbers about 55% of the entire population. It does entail, employer-based coverage does entail a cost to the federal government because we allow an exclusion from taxable income for the employer's contributions toward health insurance. That, of course, can be expensive because the people who have employer-based health insurance tend to be the highest wage workers. It's also arguably unfair because the folks who have lower wages and have to come up with their own health insurance don't get an equivalent tax break. So that is a significant cost for the population at large. The Medicaid program for our lower income population, and that includes those who don't have wage income. It also includes those who have the lowest incomes in earnings from work, is covering, now it's pressing a quarter of the population, about 22% in round numbers. That population, of course, does impose a government cost. It is shared between the federal government and state and local governments. And it's important to note that for the states, the cost of Medicaid is becoming a serious crimp on their ability to meet their other obligations. We still have about 10% of the U.S. population who are uninsured. That includes people who choose not to buy insurance under the Affordable Care Act, usually because they perceive the insurance to be too expensive. In some instances, those who do not opt for coverage under the Affordable Care Act have to pay penalties. In other instances, they are excused because insurance is deemed to be unaffordable for them.
So does the ACA affect the U.S. debt in any way?
The Affordable Care Act does impose costs to the federal government in terms of subsidies to help lower income individuals to buy insurance. It also was written to include sources of revenue, which included reductions in costs under the Medicare program, and in some other areas, a tax upon some of the medical devices that are used in the system. These were changed. That tax was changed in the recent tax cut bill from the end of 2017. The Affordable Care Act was designed so that at the end of the day, the costs in terms of those subsidies and in terms of additional coverage under Medicaid, which was made more generous, are offset by the money savers, including the taxes and including the reductions in cost under Medicare. There have been changes in the balance, but up until the point of the 2017 tax cut bill, the conclusion was that the Affordable Care Act, taken as a whole, both the money savers and the money spenders, pretty much added up to a net zero. So the answer to the question was, no, the Affordable Care Act doesn't affect the debt, but the reason was not that it had no costs. The reason was that it raised money to try to offset the costs that it imposed.
And is that not the case for Medicare and Medicaid also? Are they not net neutral?
The Medicaid program is a spender. It does not include any sources of revenue. If you take the federal share and the state and local government share, you have a pretty significant headache for both levels of government, especially now at the state level. It's causing some real problems. Medicare is partly paid for through the payroll tax that is imposed on wage and salary income. That same tax is shared with Social Security. The portion that is devoted to Medicare pays for part of the program. Another part of the program is covered in part by premiums that are imposed upon the beneficiaries. That's Medicare Part B, which is normally called the physician part of Medicare. The other part that's covered by the payroll tax is Part A, and that is covered, as I mentioned, by the payroll tax. However, Part B's costs are shared between the premiums that are paid by the elderly and the general budget. And those costs to the general treasury do, in fact, add to the federal government's net outlays, and they do add to the deficit and to the debt.
Interesting. So when young people or people who tend to be a little bit more towards the left call for things like Medicare for all, what is your response and how would that be paid for? And is it at all possible if the country decides to go in that direction?
Well, we now have a system, as I mentioned, about 2/3 of the working age population and their dependents are covered by an employer-based system. If we went to Medicare for all, generally speaking, that whole system would be scrapped and thrown away. That would entail a considerable amount of dislocation. It would also mean that many of those individuals would have to go and find different means of healthcare coverage. That could be significantly disruptive. Then you have the question of, well, if Medicare is the biggest drain on the federal budget covering the elderly, what would we expect it would be if we extended it to everybody? Now, the folks who are advocating Medicare for all are really talking about a different healthcare system than the Medicare that we have now. Frankly, most individuals who now are covered by their employers would be very disappointed if they went into the Medicare program that we have now, because Medicare as it exists involves a lot of deductibles, a lot of costs that are not paid for by the program, a lot of co-payments. So again, the individuals have to fork up the first few dollars of the cost of every service. Medicare has an extra cost add-on for prescription drug service. Many older people who are covered by employer care have prescription drug service as part of their plans. So you take all of that together, and most Americans would not be happy with the Medicare system that the elderly have now. That's why the proposals talk about a much expanded Medicare system. It would cost a lot more money. And if you think about the fact that Medicare right now is the fastest growing part of the budget, if we extended Medicare to everybody, it's not far-fetched to imagine that those growing costs would extend to the rest of the program as well. It's not clear that we could raise taxes enough or fast enough year by year to pay for the cost of covering everybody under Medicare. And that is worrisome to those who are concerned about the public debt.
If we have a clear system in place, and why is healthcare a sudden problem for the U.S. debt? You mentioned it's getting worse. Why is that the case? And what's happening?
Well, healthcare for the federal budget is probably a little bit like the people who go out and buy a nice, cuddly little tiger cub. At first, it looks like it's a tiny little animal. It might even nuzzle up to you. It is very friendly. After a period of time, you discover that that tiger cub becomes an adult tiger, and it has instincts, and it's big, and it's strong. Medicare is a formerly small program. Medicare's costs have grown very rapidly over a long period of time, and it's not a small program anymore, but it's still growing. And healthcare costs really all through the healthcare industry, including the Medicaid program and including private insurance, are growing very rapidly. That's in part for reasons like the fact that the U.S. population at large is getting older. The average individual is living longer than was the case in the past. And as people get older, they need more health care. But in significant part, the increase in healthcare costs is coming from the fact that treating any individual of any given age is becoming more expensive over time. The cost of delivering health care is growing faster than overall inflation. The reason for that is partly technology. It is partly that our healthcare system really is not terribly efficient. There are perverse incentives in the healthcare system. Much of our healthcare system is what is called fee-for-service medicine. The individuals who provide those services get paid more if they provide more services. And as a result, also because technology is improving, because we can deal with healthcare problems that in the past were beyond our power, we're delivering more services. The services are becoming more expensive, and the cost of healthcare is growing. Long time ago, in simpler times with a simpler practice of healthcare, it was a lot less expensive. Now, over time, it's becoming a lot more expensive, and we're getting to the point where that curve of healthcare costs is beginning to go vertical. It's just about achieving liftoff. And that's the problem that we have to face, not only within the federal budget, although that's the subject of this conversation, but it's worth noting also employers are having a hard time providing consistent healthcare coverage at premiums that are affordable for their employees.
Are these rising costs unique to the U.S., or is that a global phenomenon?
I've had the experience of talking to people from foreign governments when I was serving in government. And the one thing that I took away from those conversations is nobody is happy with his country's healthcare system. Other healthcare systems around the world take up less of each individual country's gross domestic product or GDP. And as a result, many people look at the United States and say our healthcare costs are more expensive than elsewhere. We ought to be able to find a way to reduce healthcare costs by looking at other countries. That may be true, but the one thing that you find if you look at other nations around the world, their healthcare costs are growing too. And if you ask people who are engaged in those systems, they will tell you to a person that they believe that their healthcare systems are getting out of control, and they're not satisfied with the quality that they get for the amount of money that they pay. So we have a problem. Really, everybody has a problem. The problems are different. The systems are different. We in the United States, for one thing, do expect that we are going to get prompt service. We expect that if we have an elective procedure we're not going to have to stand in line. That's part of the reason why we pay more. But if you go around the world, everybody says that they don't get access to the care they want, and it costs too much, and the cost is growing.
So it sounds like there's no silver bullet or one standard to follow. And that being the case, what has CED recommended to fix it if there are so many issues and not one simple solution?
Well, your premise is absolutely correct. There is no silver bullet. The people of the United States have different expectations. In part, if we decide that we want to do something different, we need to accept the fact that we are starting from a different place from where other countries are. We have invested much more money in expensive hardware. We have invested much more money in the training of specialists. Those are costs that we're going to have to deal with going forward. And we have different standards we want to be taken care of right away, whereas other countries have become somewhat attuned to accepting of having delays in the system. But all of that having been said, we need to find a more efficient way to deliver health care in this country, meeting our standards, taking into account the system that we have today. What CED has recommended is that we provide every individual with healthcare coverage on the basis of cost-responsible consumer choice. What that means is we would provide a credit to each household. The household can go out and buy insurance with that credit. That credit will buy the most efficient, lowest cost healthcare plan in that household's market area, meeting standards which require that plans provide good quality care and are prepared to deliver the services that people need. If individuals decide that that most efficient, lowest cost plan is not what they want, if they want something that is fancier in any dimension, they can go out and buy a more expensive plan. But they are responsible for the incremental cost, not the total, but the incremental cost over the amount of that credit that purchases the low-cost plan in their market area. So what that means is that every plan and the providers that work under each plan need to deliver the highest quality care at the lowest possible cost so that they will be hired by consumers. It would be consumers who make the choice, not the employers and not the government. The consumers will take their credits and they will go to the marketplace and they will buy the care that meets their needs at the cost that they believe is worth paying. If you take every plan and you take every provider and make them responsible for providing care that people can afford at a quality level that they want, everybody's going to have to work a little harder. No surprise if you think about it. Look at automobiles, look at haircuts, look at every good or service that we consume in our economy. Consumers drive what the providers give, and the providers have got to meet the consumer's expectations and needs. And because of that, and it's what we economists call competition, because of that, we in the United States have done extremely well in terms of meeting consumer needs for haircuts, for automobiles, for all the goods and services in between. We need to set the same standard for healthcare.
That seems pretty logical for me. So I assume I'm not alone in being skeptical about this, but what do you think the chances are that these changes actually occur within your lifetime or anyone's lifetime, really?
Well, your lifetime will probably be longer than mine. That having been said, one thing that we observe is that the cost of healthcare is growing unsustainably, which is to say, if healthcare keeps demanding a larger and larger share of our gross domestic product, we are going to get to the point where we literally can't afford it. The drain on the federal budget is going to add to the public debt. The public debt is right now growing faster than our collective income, our GDP, faster than our ability to pay it. And as a result, we at some point are going to look at the federal government's books, look at employers' cost of providing health insurance for their employees, and we're going to come to the conclusion that we have to change. We have to do something different. Personally, I believe that the recommendations that we at CED have made give us the best possible approach to providing quality care at an affordable cost, creating the pressures of competition to drive innovation, to give people an incentive to try to find ways to deliver care more efficiently and still at a level of quality that people need. Our current political system is not really providing improvement in any quarter. Realistically speaking, almost everything that we need as a society, all the problems that we have, require bipartisan cooperation. You need 60 votes to move most legislation through the Senate. Beyond that, any solution to this problem that is going to endure cannot be the result of the partisan pendulum swinging all the way to one extreme. If you have a solution to the problem, solution I would put in quotes, that is the result of 100% the input of one party, and the Affordable Care Act really fits that description. When control in Washington switches to the other side, when the pendulum swings the other way, the chances that that system of healthcare is going to be under siege are pretty high. And healthcare is fundamental to the quality of life for all Americans. We can't go from year to year, from decade to decade, with our entire healthcare system subject to conflict and at risk and potentially looking at significant or total change. We need a system that will endure, that has buy-in from both political sides, and therefore will move forward and will develop and will grow regardless of where the political pendulum happens to be swinging at any given moment. So, like every other major problem, like the debt itself, like our need for better infrastructure, like our need for support for national security, you take your issues from one end of the budget to the other. We will need bipartisan cooperation to come up with solutions that will endure over a long period of time. The solution that we have proposed involves coverage for everybody, which should be of interest to Democrats. We want a working, functioning market and competition, which generally is attractive to Republicans. If the two sides come to the conclusion that they can get most of what they want in a system that has the prospect of continuing in a stable fashion over a long period of time for the good of the American people, I don't know of any better idea than what we've put forward.
Thanks, Joe. You've clearly thought a lot about this, and it's very interesting to hear from you. As always, we can't thank you enough for tuning into True Chat. But did you know that you can join the conversation on our app or website, truechat.org? If you're already listening to the podcast on iTunes, Stitcher, or some other platform, you can also subscribe to our show there. For Making Capitalism Sustainable on True Chat in Washington, D.C., I'm Caroline Ferguson with the Committee for Economic Development. Thank you very much for tuning in, and we'll see you next time on Making Capitalism Sustainable.